Hello everyone, welcome to the hand exercises and mobility. So the first one we're going to talk about is flexor tendon gliding. A lot of these hand mobility exercises are going to be for patients that are post-op, that maybe have had some surgery done on them and they have limited ability to move their hand, or maybe we've got some adhesions that we need to break up, things along those lines. So the first one that we're going to talk about is flexor tendon gliding. And flexor tendon gliding is specific hand positions that we have our patient go through just to move those flexor tendons through the sheath to, again, try and break up any adhesions or just make sure that they're able to move freely. So we start with what's called a straight hand, and then you'll go into a hook fist and then a full fist, and then come out to your tabletop, and then down to a flat fist, and then start all back over. So you go up to straight hand, hook fist, full fist, tabletop, flat fist. And you just have your patient go through those as much as they can within those movements that we want them to go through, again, just to make sure that we can get as much motion as possible. Okay. Next one is place and hold. So this one's great for patients that are status post surgery, where we can just start off with some gentle isometrics. And essentially what we're going to do is passively, either we or the patient is going to put themselves into a specific position, and then we just have them hold that position. So we've got the place, which is passive, and then the hold, which is going to be that isometric hold. So it's, again, a great place to start right after surgery. Next one is going to be flexor tendon blocking. So this one, now we're getting a concentric and an eccentric portion to those exercises. And essentially we're going to block out everything that we don't want to move. So if I don't want these three to move, then I'm going to block those out. And if I want just movement at the MCP, I'll block there and then just have them come up into flexion of that MCP, and then maybe I just want flexion to occur at that PIP, and so I block out the MCP. Maybe I do the same thing for that DIP. So essentially we're just blocking out, again, what we don't want to move and isolating whatever joint or joints we do want to move. The next is extensor lag reduction. This is similar to the flexor tendon blocking, but now we're talking about extension. So now we're going to, again, we can try and block out as much as you can, but most people don't have as big of an issue with trying to move everything at the same time with this one. But we're going to go to whatever joint we only want the movement to occur at and block it out. That one's tough and the soft. Doesn't feel like I'm moving much at all. And then that. And essentially we're trying to strengthen those extensors so that when they maybe go into extension, the MCP and the DIP, then we're not getting any type of lag. It's similar to knee extension lag that you might see. And so we're trying to work those muscles at each joint to increase full range. And then the last one, differential extensor tendon gliding, that's there on your sheet. This one, again, is going to be passive, and we're just hitting all the joints, curling them up, and then extending out. And you can do one at a time. Again, this should be passive, or you can do all of them at the same time. We're just curling them up and then bringing back into extension. So those are hand mobility exercises. Then we got some hand strengthening exercises. I didn't really look over these ones. We've got our MCP flexion with IP extension. So there it is. Guess what we're working on? Our lumbricals. And so we can have them hold that position. We can try and push down so they're pushing against us as far as the MCP, or excuse me, the IP joints. And then we're trying to extend them at that MCP just to strengthen those lumbricals up. We can do it isometrically or against some sort of resistance. You can get some TheraBand, wrap it around. It's tough to get both at the same time, so you may end up just working one and then the other, but either way, we're just trying to strengthen those lumbricals up. Thumb opposition. So these are just simple exercises that we can have them do. Range of motion, where you can go pad to pad for all fingers. You can go pad to side, so we can either do side of the fingers or side of the thumb, but we're going pad to side, and then we can do tip to tip. So that would be an example of just simple active range of motion. If we want to grab some Extremity, we can incorporate that into it. Let's see if I can get this out of there. So now we just have them pad to pad. Got to pad the side like this. Or we can do that tip to tip where we're getting more of that pinching type thing in the with the resistance. So that's our thumb opposition, where we're focusing on that thumb as well as trying to strengthen it. We can again be strengthening the others. I just mentioned that because on the next exercises down it says putty exercises. So those are examples of the pinch exercises. We can also do some finger spread. So we can have our TheraPutty there. They're pushing down and trying to spread that putty out, working those abductors. They can do it while they have the TheraPutty on the side, or when they're just holding it like this, trying to spread that TheraPutty out and really work those abductors when they're trying to squeeze the TheraPutty as well. TheraPutty, not TheraBuddy. My TheraPutty. This is called resisted fisting. You can chuckle if you want to. And then we've got our finger adduction. Oh, squeeze that TheraPutty in between those fingers. Oh, and this one's going to be terrible. Not much there. Next, we have what's called finger flexor self-resistance, or the choir pose. So a lot of times in choir, they'll have their patients, or not patients, but they'll have the singers hold their hands, or you might see them holding their hands like this, where they're interlocking their fingers by going into flexion. So essentially you're going to have your patient do that, and then they try and pull apart while keeping their fingers interlocked like that. And it's really going to be a good isometric exercise for those finger flexors.
Make sure you sing while you do it.
That's right. La 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 la. I'll be right back. Next one, we've got our trumpet or spring-loaded finger flexor exercises. So most of you have probably just played around with this, but it's an actual exercise. As you can see, this one says medium green, and so you can get different resistances for depending on the color that you buy and everything like that. If you want to make it more difficult for them. Next, we've got towel crumple. So essentially, you're just going to take a towel just like you would with the foot, and you're going to have your patient crumple that towel. You can have them walk it towards them so it crumples up that way, or spread it out if they're not quite ready for that TheraPutty. And then TheraBand. Again, I'll be back. With the TheraBand, you can do resisted finger flexion and or extension. So you can do it individually where you're just curling that finger up. You can do all of them at the same time, curling those fingers up. You can do extension, again, one at a time or all at the same time. And this is kind of getting extension and abduction. If you want to just or focus a little bit more on abduction, you can have them do similar to what they did with the TheraPutty. They're kind of spreading out against it like that. And I do believe that is all of the hand strengthening exercises. Thanks, guys.